Hello everyone, today we are going to talk about the blood groups. Commonly, the main 4 blood groups that we use in the ABO blood grouping system is Group A, Group B, Group AB and Group O. Today we are going to discuss about the antigens and the antibodies present in this all the 4 groups which is needed for knowing the compatibility tests, blood groupings, etc. First, what is an antigen? Antigen is mainly any substance which, if it is present in the body reacts to this substance and releases antibodies. So, any substance, if it is present in the body, our body fights against that substance and releases antibodies. This substance now is known as antigen. This antigen we are representing like Ag, whereas the substances that are produced against the antigen or the antibodies. So antigen is a substance that is coming outside the body or some inside. If it is present, our body reacts to it and produces antibodies. So now in this group systems also there will be antigens and antibodies. So we have to know what are the antigens and the antibodies present in these 4 groups. Now we have to know certain rules for this. One such rule is antigen. Antigen will be present on the RBCs. Antigen is present on the RBCs. It is not only on the RBCs, it can be present on the platelets also. Here, for our convenience and for knowing for the test like compatibility testing and grouping, we will take RBCs. So antigens will be present in the RBCs and blood groups, whereas antibodies are seen in the plasma or serum. So here we'll understand, for example, assuming this is A group, this is B, this is AB and this is O. If on the RBC there is antigen A, then the group is A. If on the RBCs the antigen present is B, then the group will become B. Whereas on the RBC, if both A and B are present, then the group becomes AB. If none of the AB is present, then it is O group. Remember, A and B antigens are absent in O. It is not antigen O. It is A and B antigens absent in the blood group O. The rule number 2 is, if one antigen is present, then the corresponding antibody won't be present. For example, if a person's blood group is B, the antigen is B, then in the plasma there won't be B antibody. The rest of the antigen will be present like antibody. For example, for the blood group B, the antibody in the plasma will be A. Whereas for A blood group, it will be B. In the AB, we have both A and B. So, we won't see any antibodies in the plasma of AB blood group. For O blood group, there is no antigens on the RBCs. So, we see both antibody A and antibody B in the O blood group patients. Now, to know what is positive or negative, like A positive, B positive. For that, we have to know the second system, that is RH system. For the RH system of blood grouping, if the antigen D is present in any of the person's blood, then the blood is known as positive. Whereas if antigen D is not seen in our RBCs, it becomes negative. That means, example, if a person's blood group is AB positive, then the person's RBC will have A antigen, B antigen as well as D antigen. Similarly, if it is AB negative, then the person's RBC will have only A and B. Then the D antigen will be absent, but it will be seen in the plasma like antibody. So, in short, we can say the antigen present in the A positive is, on the RBCs, antigen will be A. As it is positive, we will have D. So, the remaining one is antibody B seen in the plasma. Similarly, A, B, D. B and D. whereas it is only A. B negative, A and D will be there. For the AB positive, all the three antigens will be there. None of the antibodies will be seen in the plasma. For the O positive, A and B won't be there, but D antigen will be there. A and B will be like antibodies. For the O negative, nothing will be present in the RBCs, but in plasma we see antibodies against A, B and D. This is an important chart that everyone must remember. This will further help us in groupings, cross matchings or any other test related to blood. Thank you.